Only, I think I have to declare that I'm not a spinal surgeon. I'm a general orthopedic surgeon who practiced in England for over 18 years, and partly in UK and America and Canada, and then I came here to Egypt 10 years ago. Why I'm doing this investigation right now? Because about 2 weeks ago, I had a young engineer, 23 years of age, who had discectomy by one of our eminent colleagues. And he decided to put a transpedecular screw fixation, one level above and one level below, and the end that she is paralyzed in the good side. The good side is paralyzed, the quadriceps is completely paralyzed, she cannot walk, and the other side is still painful. And this is actually what made me decide to investigate a little bit about this use of instrumentation in cases of degenerative lumbar spine. And the topic is, are we really overdoing it? Are we over-instrumenting our spine in the degenerative disease? Okay, now, we're doing this quite a lot. I see it quite a lot in my clinic, and the evidence that it is increasing sharply in Egypt in the last decade or so. We agree that the top level of the evidence-based medicine is the TCR, or the controlled trial with randomization. Okay, this is the top one. So this is the one I try to review and see the evidence of the need of doing fixation in degenerative lumbar spine. Okay, this is a common seeing we see in our clinic, and surprisingly, the patient is having a little complaint. He's not complaining because it's a physiological type of spinal stenosis, which comes very gradually, and the patient actually is living with it. He's not complaining. He go to the mosque and he go to the shopping, doing limited activity because, of course, this is an aging guy, and no complaint. And then he go for surgery and get the spinal decompression with instrumentation, and all the problems start after that. So this is we see also in our clinic. Okay, till few years ago there was no controlled randomized trial available. Until 2016, there was not a single controlled randomized trial available. And to date, there is no standard guideline in the literature to define what is stability. I remember when I was in Liverpool in 1986, the chairman started saying that we don't have an exact definition of instability of the spine, and this year, after 30 years, still the same. We don't have an exact definition of what is the spinal instability means. To date, no standardized indication for fusion. To date, many spinal surgeons give blind eyes and deaf ears to the above facts. Are we really doing too much unnecessary spinal fixation based on no scientific evidence-based medicine principles, only to subject our patient to higher rate of complication and soaring bells? Let us see the scientific basis and search the highest quality trials for the truth. Okay, now, here is spinal instrumentation, and there's instability of the juxta level above, spinal infection, pseudoarthrosis, penetration of the screw, severe restenosis following instrumentation. So it is not really a safe, benign procedure. It is not a safe, benign procedure. Okay, we are good in putting it, but there is complication, and you have to admit that there is a very serious complication the patient has to go through. So we have to really ask ourselves, does it really necessary to fuse the spine in cases of degenerative spine surgery? Okay, we'll see the evidence. I don't want to go through really this because I have a limited time, so please go on, and I'll go to the trials which I'm interested in. And interested that you see. Okay, this is actually a long talk, but I have only 7 minutes, so I cannot really go through all of it. No, go back, please. Go back. This is really a watershed paper trial. Came in 2016 from Sweden by the Swedish Society of Spinal Stenosis. Okay, they studied a huge number of patients. They studied over 247 patients, which was stratified into four groups actually, two groups, one treated by decompression, the other one treated by decompression and instrumentation, and then they further stratified it into the one with transventricular fixation, or they don't use it. Okay, it was a multicentral one, follow up to 6 years follow-up. The study outcome was studied at 2 years and 4 years after decompression versus decompression and fusion, with without spondylolisthesis. Actually, spondylolisthesis did not really matter in this paper, whether you need to fuse or not. Surprisingly, of course. Okay. None of the involved surgeons took part in the outcome assessment. The clinical evaluation included 6-minute walking test, the Swiss Disabling Index, and they did CT scan, MRI, brain X-rays. They did not do flexion extension X-rays because there's a lot of fallacies in this investigation. We will talk about it later, so it's not really, although it is one of the gold standard, one to diagnose dynamic instability, but really they did not look at it as a very important one because of fallacy and difference in observation between different people. Let's look at the complication. The dural tear was equal in both groups, but look at the infection. 11 cases in the effusion part versus 5. Reoperation, 17 in the instrumented cases versus 13 in the decompression only. 4 restenosis, 11 at the adjacent level versus 3 at the same level. The statistical analysis revealed no significant difference between the 4 groups. No significant difference. This is evidence-based medicine. This is what it says. Okay. Next, please. Okay. The conclusion: no clinical benefit from fusion at 2 and 4 years. Unfortunately, degenerative spondylosis is a benign condition with no clinical sequence. Several cohort studies had the same conclusion. Very high on the quality of the evidence-based medicine. Registry data analysis showed fusion to double complication and increase cost and hospitalization. Juan Lala, who is really one of the proponents for fixation, found that the reoperation in the fusion group is up to 34%. Next, please. Okay. Now, more high-quality level 1 ABM trial are now available to support the SSSS conclusions. Do not fuse in the spinal stenosis at 1 or 2 levels, even in the presence of any degree of spondylolisthesis. Okay. Now, these two papers, next please. These two papers are quite recent one. Decompression versus decompression diffusion for treating degenerative lumbar spine, systemic review and meta-analysis. This is the top of the evidence-based medicine. There's nothing higher than that. And what did we find? Dr. Wang, of course, is very famous spinal surgeon in China, and nowadays it's the China era. They actually revised 894 patients, okay? And only RCT studies were reviewed. The result, no superior benefit, on the contrary, more complications. Next, please. And the most recent one, only done about 3 months ago, decompression alone with or without fusion, at single level lumbar spine stenosis with spondylolisthesis, systemic review, and again meta-analysis. There is nothing higher than that for evidence-based medicine. Nothing higher than that. We have to accept the finding of these people, and that what they find, no significant difference. On the contrary, higher complication rate. Next, please. The road is still on. We have to do more randomized controlled trials and see how things go. But I see a lot of cases done in this country, fusion, unnecessary, but with higher complication. And this girl came to me 2 weeks ago, paralyzed in the left side, which was a good side, by the way, after instrumentation, which prompted me to say that. Thank you very much.
Thank you, Professor Hani. I will introduce Professor Muhammad Ning, who will speak about the proximal cervical instability.
This left.